Hello, everyone, and welcome. I'm Dr. Scott Theirl, and I'm excited to share a couple minutes with you regarding an examination technique for your visual motor system.
I'm Dr. Scott Theirl, and this is my practice, Functional Restoration. I became a chiropractor 20 years ago to focus on complex cases specializing in neurology. Subscribe and welcome.
Visual motor system is involved in all types of activity, right? And today we're specifically going to focus on one movement that your eyes and your brain work together to perform, and it's called pursuits. Now, pursuits are slow movements of your eyes. They can happen whether it's something that you're looking up close at or whether it's something far off in the distance. The key is the speed of eye movement. Pursuits happen with about 30 degrees per second or less. So you want to be able to have your eyes follow very smooth if something's moving slow and smooth in front of you. And that's called a pursuit mechanism. But when pursuits don't work efficiently and the brain can't coordinate the eyes to help pursuits work efficiently, we develop a multitude of different types of symptomatology that we may or may not recognize is how our eyes and our brain are coordinating. We may say it's just other challenges. So who's this video for? Well, if you're somebody that's had physical challenges, such as never great hand-eye coordination, right? Ball types of sports, whether it's baseball, whether it's basketball, anything that has to do with throwing and catching, pursuit mechanisms are often involved. Even though the ball itself may be coming at you quickly with its velocity, the actual speed with which your eyes move to track that ball and come in and catch it are very, very slow. Those are pursuit types of mechanisms. Another big one would be hand-eye coordination for writing, handwriting specifically. So when you sit down and you actually have to write something on a page, your eyes are following that, your fingers and your pen, in a pursuit type of method to be able to see what you're writing. So you may notice that individuals that have difficulty with vision pursuits prefer to type or listen, but they don't necessarily like to write, or their handwriting may be quite messy. So it's always fun to watch individuals when they're in here who have difficulty with pursuits, watch their handwriting improve as time goes on because their eyes and their brain can coordinate better, which is really, really neat. You may notice that if you're somebody who doesn't like crowds, so in a crowd, you have people slowly moving by you, you're using your slow pursuit mechanisms and your peripheral vision to follow what's happening. And if it doesn't feel good, that could be a visual pursuit challenge. And that happens a lot, right? That same person may be able to sit on the side of a highway and watch cars go by quickly all day long and feel just fine, but you put them in a crowd and they just don't feel good with their pursuit mechanisms and their visual motor system and their brain. So that is one option that can happen too. If it gets severe enough, you may notice that you'll start to develop nausea. It may even result in dizziness and a general sense of a fight or flight system that kicks in, your sympathetic nervous system, and you just go, yuck, this doesn't feel good. I need to get out of here. I'm just going to avoid these situations. So listen, when we talk about the visual system, there's all types of challenges that can happen. Pursuits are but one of those, right? And this is going to be a short window into the pursuit examination that we do in the office that you can just see how it's done in a very low-tech way. Thank you for your time. Thank you for being here with us today. Without further ado, let's teach you something new. Now we're going to move into slow movements called pursuits. And pursuits are where you have to track an object slowly in front of you in various directions. And you'll see this in all different directions. Pursuits. Typically, you move in an H pattern in front of a patient. That's historically what would be done at a neuro exam.
Cool. You can even do diagonals if you want to.
And you're looking for how smooth things are. Do we fall behind? Do we lead? Are we jumping ahead and then having to stop and come backwards and find the target again? Or are we nice and smooth? Here's an earlier exam. Same test, same patient.
Okay. Keep watching his nose. We're just going to go smooth. These are called pursuits.
That is an Albert Einstein finger puppet that I like to use. It always gets everybody smiling and laughing, and it's fun. But again, finger puppets work great for examinations. I know that sounds childish, but it's completely true. So when we look at the pursuits with her, we notice that she's pretty darn smooth, right? Regardless of what direction we're going. And remember, with functional neuro exams, we're starting to not only identify what the aberrant movement patterns are and aberrant sensory issues are, but we're also painting a picture of whether it's more of a right brain versus a left brain or left hemisphere fatigability, because these pathways are very well known. As you pursue an object towards your right side, it's more of a right hemisphere function. And as you pursue an object towards your left, it's more of a left brain function. So we can start to paint neurologic fatigue and functional neurologic findings in terms of a hemispheric model, not only for diagnosis, but also for care then, and we know which way to go. In this case, her pursuit mechanisms were pretty good. So hey, we like that a lot. We don't see any big aberrancies. She's not slowing down, having to catch up to the target. She's not going too fast and having to come back to the target, which is great. Pursuits, pretty great. This doesn't take an entirely long amount of time in terms of these basic eye movements. And it starts to paint, hey, what's easy and working well? What's having a hard time and not working so well? How does that tie into your specific symptomatology with what you're presenting with? And then most importantly, what do we got to do to make it better? Because we've got to make these sensory motor systems work better. That's what brain-based rehabilitation is all about here in a functional neurology or a chiropractic neurology office. And again, you can imagine just how challenging it is, sometimes just with walking and balance systems, sometimes paying attention and concentrating to what's going on in the world around you, whether you're a student at school or whether you're at work, right? It could be sports performance. It could even be driving potentially, which is horrible to think about, but very true. We want these sensory motor systems of these eyes to just be top-notch, super strong, can't fatigue them, can't trick them, away we go. And then we're happy with that brain and those eyes and how they function. Truly a window into how the brain works, these eye movements are. All right, everybody. Well, that is it for today. If you enjoyed this video, go ahead and smash the like button, hit the subscribe to our channel button, and the bell notification button so that you're notified when we release new videos on various topics. And while you're at it, be sure to check out some of our other videos on our YouTube site as well. They're filled with information on musculoskeletal care, various functional and integrative medicine topics, as well as neuro rehab. And with that, thank you for your time. I appreciate it greatly. Wishing you your very best body, your best brain, and your best life. Take care.